is Mary Beth, and I live in Danville, Kentucky. I was diagnosed with bladder cancer in 2014 when I was 28 years old. Today I have a wonderful husband and 2 young sons, ages 3.5 and 7 months old. I live on a farm and I enjoy spending time outside with my family and friends here, very close to my parents who also live in my same town. And I love yoga and reading and discussing important events with my family and friends. I hope to have a career in patient advocacy and healthcare because I firmly believe in patients supporting patients. I was diagnosed with bladder cancer in February of 2014, and the way that I learned of my diagnosis was that I started noticing blood in my urine, which was my first symptom that something was wrong. I noticed it about 3 months prior to going to a urology office, and when I first saw it, I really didn't think much of it. I felt like it was probably a UTI or my menstrual cycle, and I was pretty busy with life and rushing around, quite frankly. So I kind of let it go, and then one day I decided I couldn't anymore and really needed to see a specialist on this particular issue, and so made an appointment with a local urology practice and went to see them, and they scoped my bladder and could immediately see visible tumors inside my bladder. They also detected blood in my urine sample, although not any visible sign of it at that time. So I was scheduled for my first TURBT surgery to remove tumors and to get a biopsy for those, which I was not expecting to be cancer, but did find out that week that in fact they were cancerous, and the feelings that surrounded that were utter shock and dismay, despair and worry, and just completely thrown for a loop in my busy 28-year-old life. The biggest things I learned after my diagnosis were really the fact that I had a high-grade cancer, that I had non-muscle invasive bladder cancer, but quite a lot of tumor inside my bladder, and the high-grade nature of it gave me a lot of concern. So sitting down with my urologist that time was showing me and talking to me about all these potential outcomes and progression and the things that were, quite frankly, very stressful, very negative, just pretty heavy stuff. And so I knew after that meeting with that first physician that I definitely wanted a second opinion, and I wanted to go to the best in class of urology practices in my area that had the most cutting-edge technology and were the best equipped to deal with this, because it certainly was serious for me and my family, and we knew we needed to go to that second opinion and find out what was going to be the best treatment for me. I learned about Blue Light Cystoscopy with Cysview at my second opinion with a new doctor that I was seeing, and he was fantastic. He told me all about this latest technology that he was using on patients to light up their bladder, to be able to see more of the inside of the bladder while performing the TURBT surgery. And it was something that I was very intrigued with and felt really confident in my physician when he described how it would help him have a better view, and that there were very little to no side effects of it for me. He really felt very confident that it would go very smoothly, and it did. So my first experience was with this particular technology in the hospital. I came a little bit earlier to my procedure and had to wait a little bit longer before I could go back to surgery. And so that was all that was extra. It was just a little more time, but I had no pain or discomfort, and I really didn't have anything unusual about the experience. It was very seamless and just took a little bit extra time. After my initial experience with Cysview, I had 3 more TURBT procedures using the blue light technology. And so over about the course of 10 months, I was having Cysview instilled 3 different times. And those TURBTs used the technology to look at my bladder to see if any more tumors had returned or if just to biopsy the inner wall of the bladder. For those diagnosed with bladder cancer, I want to tell them that I understand. My heart is with them. I've been in their shoes in that first cloud of trying to understand what the diagnosis means and how heavy that feels on you as a person and your family and support team. I really do want them to know they're not alone, that there are so many others out there who have survived bladder cancer, who've even thrived with the disease, and for them to never feel alone, that there is a community of thousands upon thousands of people living with this disease and living amazing lives. I want them to know that there are so many resources that they can turn to for support and comfort and knowledge. I would encourage them to seek out information through Beacon, the Bladder Cancer Advocacy Network, as well as talking to their physician and, if possible, a additional resource at their hospital, such as an integrative medicine center or a patient and families resource center that exists in many medical centers. I would encourage them to connect with others dealing with cancer of any sort, but especially bladder cancer, so that they can understand more of what others are going through and not feel alone and disconnected in this. I would like them to know that they are stronger than they even realize, and to never give up hope and to never give up on themselves.
Important risk and safety information. Cysview, hexaminolevulinate hydrochloride, is an optical imaging agent used to detect non-muscle invasive bladder cancer in patients suspected or known to have lesions on the basis of a prior cystoscopy or in patients undergoing surveillance cystoscopy for bladder cancer. Cysview is not a replacement for random bladder biopsies or other procedures used in the detection of bladder cancer. Anaphylactoid shock, hypersensitivity reactions, bladder pain, bladder inflammation, cystitis, and abnormal urine tests have been reported after administration of Cysview. The most common adverse reactions seen in clinical trials were bladder spasm, trouble urinating, discomfort when urinating, frequent urination, blood in the urine, and bladder pain. Cysview should not be used in patients with large amounts of blood in their urine, any known allergy to Cysview or any derivative of aminolevulinic acid, or porphyria, a condition that means you already have high levels of porphyrins in your body. No specific drug interaction studies have been performed.